Yes, this was a very interesting analysis that we took upon to look at because we had recently approved for JAK inhibitor in patients with myelofibrosis, Momelotinib, and the approval actually was based on the anemia. So the data that showed that Momelotinib is actually an anemia helping drug rather than anemia causing drug as Ruxolitinib has been seen ever since the phase 3 studies of Momelotinib emerged, which was SIMPLIFY-1, SIMPLIFY-2, and Momentum. So we actually look at the SIMPLIFY-1 data and then try to understand whether decreasing transfusion dependency would have any impact on saving on the medical cost, on the outpatient cost associated with transfusions, as well as time burden. Because getting transfusions are surely a time burden instance where patients had to come to clinic, had to wait for the transfusion, may have adverse events, then had to be monitored. So all of that basically came into the consideration. So we pull up the data from the SIMPLIFY-1 study on the 24 weeks transfusion dependency or independency and compare them with data that we obtained from available marketplace databases as well as Medicare fee-for-services for patients over the age of 65, and then extrapolate the data from known transfusion-dependent thalassemia B patients for the time burden. So it's kind of an indirect establishment, but it still gives us the best ideas about how much we could save in time and the money. And actually what came up from it was one, as we known and we have seen that Momelotinib at this study showed decreased transfusion dependency and increased population of patients that would actually require transfusion, even if they started transfusion independent. And then we have actually seen with that medical cost that ranges from about $20,000 a year to about $50,000 a year, depending on what subgroup we looked at. So we look at the whole population, then patients that were transfusion dependent at baseline, then patients they were transfusion requiring but not completely dependent, and then patient over the age of 65. In each of those categories, Momelotinib provided medical cost saving in $20,000 or more, then saving for outpatient transfusion-related costs that was about similar, and then the time burden save was about 106 hours or more a year. So actually there were over 130 hours saving for some patients that would require more transfusion if they received treatment with Momelotinib versus Ruxolitinib. So that study suggested, aligned with the approval, which is intended for patients with anemia, that we may have a drug that could not only decrease patients' burden in terms of transfusions, but even help us to save some healthcare resources, and more importantly to me, time for our patients. Because really being transfusion dependent is a very burdensome task to our patients, and it really adds to a lot of their fatigue and additional things we have to deal with. So that is something really positive, and of course we need more data for the future to see how these drugs are going to interplay in the real life, but I was excited about the findings.